Hello, everyone. Thank you to IPOPI for inviting me to this great IPOPI Third Regional Asian PID meeting. It would have been wonderful for me to be joining you in Japan, in Kyoto, but I think during these pandemic times, we are lucky enough to be able to share knowledge on primary immunodeficiencies throughout this virtual meeting. So I've been invited to give a talk on transitional care. I'm going to start by sharing my slides right now. So I think you can see my slides. And I have been invited to give some insights on how to manage the challenge of transitional care between pediatric care to adult care. So just a little bit of background on rare diseases, which are a huge group of very versatile diseases of approximately 8,000 to 9,000 diseases, which accounts for approximately 6 to 8% of the total European population. And very importantly, more than the half of these patients are youth. So they're aged below 18 years old. Just for France, which is the country where I live, with 66 million inhabitants, it accounts for approximately 3 million youth, which is a huge number. So we're talking about a problem of public health. So patients with rare diseases often have multiple disorders at the same time, high impact on their lives, and they usually need different kinds of healthcare, simultaneously or during their lifetime. But the problem is that many stakeholders have a lack of essential knowledge on rare diseases, and that might hamper the transition care. So just a few verbatims from patients in the Necker, Paris, France hospital where I work. And I think they are very interesting regarding the topic today. One of them is, I will never leave my pediatrician. For so many of the patients, they know their doctor for, they can't even remember since when. And my doctor doesn't answer when I ask her, when am I going to die? Which is a very distressing kind of question, but unfortunately, many of the rare diseases that we are dealing with are very severe and limit the lifespan of the patients. Some questions that are very stressful to patients is about reimbursement of medical costs. Many of the treatments are very expensive, and in some countries, the social coverage stops at age 18, which is a major problem. And the last one, which I like as well, is that I prefer to be seen by an adult physician because I get a more frank dialogue. So I'm a pediatrician, which I think maybe you don't know, and I believe that we, as pediatricians, sometimes have some different, perspective on things compared to adult physicians, and we can get to learn from them as well. So next slide. I wanted to share with you a very recent paper from a Paris group, which has built an e-cohort of patients with with chronic diseases. And they were asking them, what are the priorities to improve your care? So one is transforming care to be holistic and personalized, even at a consultation level, smoothing the patient's journey in the care system by increasing their knowledge on their own health, and also improving the care coordination, training physicians in better interpersonal skills, reducing stigma, and making care more affordable. And the last, on the conclusion, I highlighted the last sentence. Implementing simple actions could benefit actually a large number of patients. So that's not only about transitional care, but I think transition is part of the questions and the problems that are highlighted here. So what about PIDs? Very interestingly, there are more and more emerging data and publications on the fact that PIDs are not only a pediatric disease anymore. And I just highlighted one of the papers that I co-authored, and a nice comment by Andy Jennery and Steve Holland. It was about CGD. So PIDs are rare, per se, but multiple, more than 400 actually. They are chronic, lifelong, and sometimes complex conditions. They require specific high-level management and care with immunoglobulin replacement therapy, bone marrow transplantation, gene therapy, and we need more awareness, more diagnostic facilities, and we need to improve the survival. We need specialized units, and I wanted to highlight and stress the fact that we need more adult specialized units, and transition care is needed for patients diagnosed during pediatric age, including the ones diagnosed at teenage. So what is transition? Transition is a dynamic process, a lifelong process that seeks to meet chronically ill children's individual needs as they move from childhood to adulthood. The goal of the transition is to maximize the functioning and the potential of these patients throughout the provision of high quality and developmentally appropriate healthcare systems services that continue uninterrupted. I think it's critical here, as the individual moves from adolescence to adulthood. So this is an international definition, and this little cartoon at the bottom of the slide shows that there is a dynamic process that can take several years that is named transition, which is a little bit different from the transfer itself, with the pivotal moment when the pediatric care is interrupted and moved to the adult care. So transfer is one specific moment. So on the other slides, these are unpublished data from the French PID registry, which is one of the largest PIDs worldwide. And we can see that the median age of alive patients today is 23 years. So it means that 50% of the alive patients are aged above 23 years. So we still, it's not only pediatric disease, but we still have a lot of patients who are under 23 years old, and they will move to the adult facility. So we still have a lot of patients coming. So why do we need transition care? So these patients face a lot of problems: loss to the healthcare system, poor compliance with the treatment, leading to potentially irreversible organ damage, impairing their life expectancy, certainly impairing their quality of life. And all of this has a huge cost on health, physical, mental health, but also cost implications. So there is a vital need to ensure easy access to essential healthcare and support during this transition period. So we need to bond a bond of trust between patients and families, and the pediatric and the adult teams as well. And as you can see on the little cartoon, we need to talk more in between pediatric doctors and nurses and adult doctors and nurses, and we need cross-fertilization. So when should we transfer to adults? Usually it's around 18 years old, obviously upon information and willingness of the patient and the caregivers, willingness and also readiness. So if there are several affected siblings, we might want to do that jointly. Obviously, if they have a close age gap. Occasionally, if there are developmental or cognitive or psychological issues, we might want to delay the transfer. And it's important that we coincide with not only the tertiary care, but also the local care physicians. And I think very important, avoid transfer during an emergency, a complication, typically on a Saturday evening. Just move from pediatric to adult care is not a good idea. Some of the hurdles, obviously time of transition can coincide with compliance issues, therapeutic or others, and we need to deal with that before transferring, ideally. And the multidisciplinary input is needed for those with complex primary immune deficiencies or multiple comorbidities, so respiratory, gastroenterological problems, we need to have a better, well-defined pathway. There is not only one model. There's a multiplicity of models, and I think we should just need to stick with the ecosystem of your center and the adult centers. So one interesting way to think about that is this slide, and moving slowly from the youth being passive to more active and potentially being the supervisors / CEO of its own care. And it's nicely shown here on this slide that the patient at the center of the care moves slowly from the pediatric care to the adult facilities with a personal folder, different steps. Everybody is well organized and knows exactly what to do. Obviously, this slide shows more of the reality of things in our experience. This is more complex, this is a little bit more chaotic, but it works, and there are solutions to help the patients, move slowly from one side to another. So in the care, I've built a program which is holistic for all 4,000 rare diseases, and that is an alternative to the medical care that is delivered in the medical services, and this is for the patients to come as they are, and we deal with the 7 common denominators, and we even received an award of the Prix Galien last year for that. So the key point is optimizing health and facilitating each young person's potential, maximum potential to be attained. We should start early, usually at 13 years old, and it doesn't stop at the transfer, but rather at 20, 21 years old. The patient caregivers and primary care provider have a key role to play. And it's usually an ideal time to rethink the diagnosis, both clinical and genetic diagnosis, and also go beyond strictly medical issues, as I just showed for what I'm doing in the care. And transition is not only about health, it's also getting ready to enter the adult world. So just a little bit of the slides on what this facility looks here in the care. And we tell them that you come as they are, whatever the disease they have, PID or other kind of rare diseases. And this is just to show you how unique this looks, and it's in the middle of the hospital, in between the adult sector and the pediatric sector. And we also use the electronic facilities, and we build tools with them, and these are patients with cystic fibrosis, and we did a hackathon which is aiming at developing e-health solutions for them. And this is a mobile app that is in French, but it's already available, and it's one of the items that we developed. So newborn screening is key to improve the survival of patients with severe primary immune deficiencies. We need to define better outcomes. We need to improve the quality of life for patients, the socialization and the well-being of patients with PID, and to help them to become fully active citizens contributing to the society, because this is what they want. Thank you. And some resources for patients and doctors and nurses are on this last slides. Thank you very much for your attention.